I missed y'all so much. So as you can see, I have my Mickey, because y'all know I love Disney. Like, look at this. Disney jacket, Walt Disney World. You know, I got the whole Disney canvas wall over there. I got Mickey's suitcase over here. Y'all, even my passport is Disney. Like, you cannot. So me and my family are all going on a family vacation, and I don't just mean my parents, my siblings, and their kids. I mean my aunts, my uncles, cousins, my nieces, my nephew. We're all going on a family vacation. We only have a couple more weeks before we leave. But I personally have to take care of a few things before that happens. So let's get into the tea. Also, if you're wondering what I put in my smoothie, I have chia seeds for my digestive system. I have raw oats. I have guava juice, strawberries, blueberries, and yogurt, frozen yogurt chips. All right, so for the tea, I was recently diagnosed with 2 ovarian cysts. Just let that sink in. Y'all, not 1, but 2. So I'm gonna tell y'all the story.
All about how my life got flipped, turned upside down.
I went to the doctor. I went to an orthopedic thinking, yeah, you know, I'm having a lot of shoulder pain. It could be impingement. It could also be a rotator cuff tear, or a slap tear. We didn't know. So, okay, let's give you a shot for an anti-inflammatory or whatever kind of shot it was. And then we'll set you up with some physical therapists so that you can start kind of like moving it, and let's see if that helps, yada, yada, yada. So after I got the shot, a couple days later, I started having the bleeding. In my mind, I'm like, okay, it's that time of the month probably coming up. I usually check in on my flow, so I'm like, all right, well, maybe, you know, this is pre-menstrual, like all my ladies, you guys know. So I was like, you know, it's just my pre-menstrual happening. I'm good. It kept going a couple days. Now it's a week. And now I'm like, well, dang. Is it really gonna like do this month? Like, my menstrual is tripping this month. So I was talking to my mom. She was like, yeah, you know, just keep monitoring. I was like, you know, ditto. And then I also looked up some stuff online, and I'm like, oh, first of all, I learned through this, do not Google your symptoms without fully having like an idea of what it could be. Because when I tell you Google will kill you 5 years ago, like Google will have killed you 5 years ago and you're still here looking up your symptoms. Because when I tell you, I kept looking up stuff. They were like, oh, you have hole in one of your intestines and a hole in your stomach. And I'm just like, well, I feel like I got a hole in my stomach after reading all of that. Like, what do you mean I have all this stuff going on just from a shot? Like, really? So then I kept on looking at the information from the shot that I had, and it said it caused the bleeding because it has like some type of blood thinning components in it. So I was like, okay, whatever. When my cycle comes on, it'll go off. So now I'm still spotting. Spotting's getting a little heavier. So then I'm like, so then we go to Disney Springs, you know, my happy place, one of my happy places tied to Disney. And we go to a restaurant. I go use the restroom, and I'm like, I know this really ain't going on. So a couple days later, again, it happened. It kept going. So then my mom was like, you need to call the doctor and set up an appointment with an OBGYN to figure out what's going on. So I was like, say less, because that's what needs to happen, because your girl is now scared. I'm terrified. So I go and I set up the appointment, and I go in. oh yeah, we're gonna do a pelvic exam. First of all, when the doctor says a pelvic exam, I'm thinking, oh, they're just gonna push on my pelvic bone and we're just gonna see, you know, if it hurts. Does this hurt? Out. Does this hurt? No. Okay, cool. This is what it is. Joke was on me because I didn't know that they were gonna do an ultrasound, and not just one on top, but they were gonna do something called a transvaginal or whatever it's called, which is basically inside of you. Yeah. Was not prepared for that at all because why? Like, who made this? I'm like looking at the screen because some kind of way they had the regular computer monitor as well as a screen, I guess, for like mothers or like new parents or just parents to like see like the baby as well. Well, me, I don't have a baby, so I'm being nosy on my own body, like, what is going on? So then I'm like, okay, well, do I get the results now? So she's like, oh yeah, we're gonna take you back to the room and you're just gonna sit there and just wait for her. She'll come in with the results after she reviews them. So I'm like, cool. I'm sitting there scared out of my boots, shaking in my boots. And so the doctor came in, she's like, well, everything looks normal as far as the V bleeding, you know, usually medication does that. So it should, you know, once your body adjusts to it, you know, all your hormones and stuff, everything will be fine. However, and I was like, oh Lord, my head started spinning and I'm like, Lord, she finna tell me I died 5 years ago. She's about to tell me I died 5 years ago. Oh my gosh. And so I was like literally I was scared. And I was in the room by myself. My mom was at work. So I'm just like, oh my gosh. If I fall out in these people's office and show my tail, how do I, I'm by myself. So if I do that, I don't have my mom to be like, oh yeah, she's good, and like fanning me to bring me back. Like, so the lady was like, you do have an ovarian cyst. And I'm like, I have a what? She's like, yeah, you have an ovarian cyst. So again, I'm like, I have a what? Because you're talking and you ain't saying nothing. I have a what? And she was like, you have an ovarian cyst. And so I'm like, okay. And she was like, yeah, have you been having like any lower back pain and stuff like that? And I'm like, yeah, a lot. And sometimes it comes and goes, but lately I've been having like some lower back pain. And she's like, yeah, well, you have a cyst. You have a large cyst. And I'm just like, oh, so we went from having a cyst to now it's large. Okay. Was not expecting that. And so then she's like, yep. So, we'll see you with the follow-up in 6 weeks. Okay. That appointment to like maybe like 2 weeks later, I started having a lot of pain. So I went to the ER because they're the hospital. Push come to shove. Where else can you go at that point? So I went there and they were like, what brings you in? You know how they like to ask all the dumb questions. So what brings you in? Oh, okay, so when did that start? Like, I didn't write that all the way, like, all of that on that little sheet of paper they give you when you walk in. So I'm like, yeah, pain level's 10. Yeah, I have a large ovarian cyst on my left side. I'm having a lot of pain, blase. So they end up taking blood. Oh, Lord. And you would think, like, as many earrings as I have, I should be good with needles, but no. Y'all, a whole needle is different. And so they stuck a needle, took some blood, and I'm just like, whoa.
Whoa! And then we were like, whoa! And then you were like, whoa.
What's going on? So then they end up giving me fluids in a room. So, like, they put me in a room and they end up giving me some fluids. So I'm like, cool. So I'm in the room, like my arm is still like this because I hate when they say, oh, you can bend it. It's flexible plastic. I don't know any plastic that's flexible. I kept my arm like that. So the lady came in and she did a pap smear. You know about that pelvic exam? Yeah, I'd rather have had the pelvic exam versus the pap smear, because all my ladies who maybe have not had a pap smear, which you should get them annually, or at least 2 years or so. Yeah, they're painful. She leaves and then someone else comes for the ultrasound. Now by this time I'm like, okay, I'm good. Pelvic exam, got it in the bag. I'm experienced at this point. So I'm ready. She does it. And then they're like, yeah, you still have the cyst. Everything, it hasn't burst or hasn't twisted, which is honestly great news if you have an ovarian cyst. You don't want it to turn over on your ovaries or on your ovary, because it can cut up the blood circulation, and then you can in turn end up losing that ovary, which can then cause you to have a hard time getting pregnant. So like with me, because I don't have any kids, I want to preserve both of my ovaries. And although I only have one cyst or two cysts on one side, you can still get pregnant with one ovary. It'll just be a lot difficult. So, But, yeah, so she's like, yeah, you still got the ovary. Everything looks good. You still have blood supply. Awesome. So then, it's time for me to get dismissed. I'm in like the little waiting area. Like, yo, can y'all get this? Because mind you, I still got this IV in my arms. I'm like, yo, can y'all get this IV out? Because, baby girl. And so they were like, oh, yeah, well, we need to wait a little bit, see, just in case, you need to be kept. And I'm just like, need to be kept. If y'all wanted to keep me, y'all would have kept me back in the room and not sent me back out here with all these other people waiting. So whatever. So I'm waiting on the rest of my results from my ultrasound, waiting on my discharge papers and my work note. And the ultrasound lady or the ultrasound tech and her student, they come running out with a wheelchair, and they're like, we need to bring you back because there's a possibility you have 2 cysts, not just one. And I'm like, everybody looking at me, and I'm just like, everybody looking at me like, what you gonna do? And I'm looking at them like, what you looking at? Because I'm scared. Put me back in the wheelchair, and I'm just like, oh my gosh. And the lady's like, oh no, honey, like, I love her. I wish I knew her name. But she was like, oh, don't worry. It's just a possibility that there is another one. We just want to make sure that what we're seeing is correct or whatever. And, the doctor just wants a video. And I'm just like, okay, cool. We'll do the video. Just come on. So now this is my 3rd pelvic exam. So I'm just like, oh my gosh, I already know the drill. Give it here, And so she's like, yep, you have another one. And we're trying to figure out if they're fused together into one big one, or if it's 2 separate ones, but they're just really, really close, pushing up on each other. And I was like, oh, wonderful news. And so I, in turn, ended up having 2 ovarian cysts. I have the first one that I was told about that was large is 6 centimeters, which is about 2.36 inches. So almost 2.36 inches, so almost 2.5 inches. And then I have another cyst, which is 3 centimeters, which is 1.18 inches. So yeah, that's basically how that whole story unraveled with me. And fun fact, our ovaries are like literally small. And not that I thought they were like huge or whatever, but when they say like, oh, you have a 3 centimeter and a 6 centimeter cyst, I'm just like, oh, okay. I mean, that sounds big. But then when I look at the size of an ovary, that is huge. So like, for example, like this is just rough estimation, right? So like if my 6 centimeter cyst is this big, right? And my ovary is like the size of this, right? So that's like that. And then you have the other 3 centimeter cyst, which is like this size. So I have this size of my ovary, which is 3.5 centimeters. And this is one of the cysts that's 3 centimeters big. So if I have these 2 are almost the same size. And then I also have the 6 centimeter cyst there. I love my references. So I'm just like, in my head, I'm processing it all, and I'm just like, whoa, like, not only are our ovaries just about the size of a grape, but I also have a cyst the size of a grape, as well as between the sizes of an egg and an orange. So I'm like, how does that work? So fast forward to now. Last week I ended up being rushed to the ER because when I was at work, I don't know what happened, but I just broke out in a bunch of sweat. I almost blacked out, and my parents had to come and pick me up so I could be taken to the ER. And it's just because it's close to that time of the month, so they were like, you know, you're releasing more eggs. And so I'm just like, oh, okay. Yeah. So I'm releasing more, which is, I can't say it's not good, but it is what it is. So I mean, it's not like I can stop ovulation unless I get on like birth control or something. And so yeah, the doctor was just like, you know, it's close to the time of the month, so you know your body is naturally doing what it's supposed to do. So you're gonna have a little extra pain more than what you're supposed to, or what you are already experiencing. So I'm like, okay. So yeah, but before I went to that second ER visit last week, I went to my OBGYN's appointment, and she was like, hey, you know, heard you were experiencing a lot more pain. And I'm like, baby girl, you heard right. And so she was like, you know, well, we can put you on, we can try birth control, you know, and see where, you know, that kind of helps at. And I'm looking at her, and maybe she saw the pain in my face, in my eyes, like my body language, because I was sitting to the side. And she was just like, you know, there's also laparoscopic surgery. I think I said that right. She was like, you know, they'll just make like small incisions and basically just take the cysts out if you're in that much pain. And so like that's one thing that I don't like about doctors, and I'm pretty sure is universal for a lot of people. When I go to the doctor, sometimes I feel like doctors do not hear what we say as a patient. Like, obviously we're the ones experiencing the pain, the discomfort, the agony, the everything, and y'all are just outside looking in. We're inside looking out and trying to express how we're feeling. And she was just like, oh, we can try birth control. And I'm looking at her like, ma'am, first of all, birth control makes you gain weight. I'm already gaining weight from ovarian cysts, and then you want me to try something as though I didn't come in here with a buttload of pain. Like, you want me to prolong the agony to see if birth control would pretty much help. And see, even if I took the birth control, I ended up still going to the ER like 2 days later. So I'm looking at her like, you know, birth control is not something that you can just start right now and it works very, very fast. It's something that has to eventually, like, your body has to catch up to it. So you're talking like another 2 months for me trying this theory out. So I'm just like, no, I want it out. So she basically sent me over to one of her colleagues. I have that appointment coming up where I'll discover when my surgery is. And that brings us back up to speed of the reason of this video. So it's a possibility, like a strong possibility, that I will be having surgery before the trip. The trip is maybe in I think it's in 6 weeks. And I go in 2 days to discover when I'll have the surgery. First thing that's not going anymore are these pants. Now, they're lined for like swimming or working out, whatever. What is that, like a dry fit? But these won't make it into the bag, okay? Next, I have these shoes. Yeah, again, not gonna make it because I'm not gonna buckle and risk falling on my behind. I do that enough barefoot, okay? Next is a cover up. I really want to take this cover up because I really like this cover up. It really covers me up. But then I'm also like, am I getting in the water? The answer is no. I may put my feet in, but is it really worth it? No. So one thing that I will say is gonna stay more than likely is this dress. It has like, what kind of flowers are those? I don't know. But it's just tropical. So it's just spaghetti strap, slip on. It's easy, it's simple, the whole nine. So that's gonna stay. Next I have, this is a set. So I have these pants that go, well, in this shirt, because this shirt goes with that color. And then this is like the little vest that goes with it. So this is good because it's nice and light. And honestly, I could probably pull these pants up maybe like above my belly button, because I think I've seen some incisions where you have like an incision in your lower abdomen, your belly button, and somewhere else. So like I feel like this could probably still like go, and you know, it's not too tight, it's not, you know, hurtful. To me it won't hurt. Next I have this. I know you're like, what the? So it's a one piece. Is it backwards? It's definitely backwards. I knew that. Just wait for y'all to figure it out. So it's an outfit like this. And then it ties in the front or whatever. It's cute. And it's shorts. So yeah, this is gonna be good though. It's nice, light. Like I said, at this point, I'm focused on being comfortable because I don't want to deal with the pain and be uncomfortable. Next, I have this outfit. The only thing I can say about having these outfits now is that, well, if I get a boyfriend sometime in this some day in his life. Next, I have this tropical shirt. It's so beautiful.
I like that boulder. That is a nice boulder.
I love this. And I also have this one as well that has palm trees on it. And then this, I have some shorts. But again, it's jeans. And when I originally packed this outfit, I was not expecting to be having surgery. So I need to find some bottoms for these two tropical shirts. But I also found some dresses in my drawer that will make the cut, because your girl will be cut. So I have this dress, if you remember it from one of my Shein try-on haul. Happiness. It's a striped dress, but it's a dress, so it's easy to slip on. I also have this dress that, to be honest, I never wore, ever. It's spaghetti strap, and I don't like to wear spaghetti strap to church. So I'm gonna have to try this on first of all, because I don't even know. And where's the front? And which one is the back? But that is the end of the video. Hope that you guys enjoyed. Don't forget to like, share, comment, and subscribe to the channel. Stay tuned for some more updated videos. And I will see y'all in the next one. Peace.